This video I'm going to go over some tips to try to improve your Dupuytren's contracture or your trigger finger that you may be having in the palm of your hand or in your fingers here, what's known as the A1 pulley area. This can affect multiple areas of the hand. Now this is more common in people that are either been diagnosed with rheumatoid arthritis or maybe you're diabetic. There's also some other conditions. There's thought to be some connection there. And so this can be also from repetitive strain, just a lot of movement. Not a lot of great research to really nail down 100% what causes this. And then the treatment, sometimes you get kind of mixed results. So conservative treatments sometimes work, whether that's therapy or steroid injections, or maybe you end up having to have surgery to have some of the scar tissue or the thickening of that tissue removed. And so I'm going to show you some techniques you can do at home to try to improve your range of motion and your strength within your hand, your fingers. First thing we're going to do is wrist strengthening. So what I'm going to do is prop my forearm up here. We're going to go into wrist extension. You want to take a dumbbell that's fairly easy to use initially, and you're going to work on 2 to 3 sets of 10 to 15 repetitions going into extension. Then we're going to flip over into wrist flexion, and I'm going to come this way. The same thing, 2 to 3 sets, 10 to 15 repetitions. Sometimes this can be painful just to have the dumbbell resting in the hand in this area that's irritated. So if that aggravates it or irritates it, then you can stay away from that. But if you can tolerate it, wrist strengthening is a great place to start to try to improve overall function of the hand. Now we're going to work on finger extension. Now Dupuytren's contracture or trigger finger affects the palmar side. But as always, I like to work on the entire hand or the entire area, both the antagonist and the agonist. So the agonist is going to be the area in the palm where the actual movement's occurring of muscle contraction. And the antagonist is going to be the muscle group on the opposite side that performs the opposite action. So I just like to work on both areas. So I'm going to use these finger extension bands by Alpha Grips, and I'm going to go into finger extension, and I'd perform 2 to 3 sets of 10 to 15 repetitions of this. You can also move these down. You can keep them on the fingertips here. You can move them down different places on the fingers and just work on different areas. I do like these. They come in sets where you can kind of go through level 1, level 2, level 3. So that's really nice, and that's by Alpha Grips. Next is going to be finger strengthening. So I'm going to use one of these finger exercisers here. So what you're going to do is you're going to go, I'm going to start with my fingertips on the end and just kind of pushing down into this. There's different types of these or different resistance levels. I would start with one that's a fairly light resistance level initially. I'm going to go for 2 to 3 sets of 10 to 15 repetitions, and then I'm going to move this down to my fingers. I'm going to kind of work on that lumbrical grip, kind of going flat as best I can. You can't keep all the fingers or all the digits extremely flat with this. They're going to bend some, and that's normal. And again, I'm going to go for 2 to 3 sets of 10 to 15 repetitions. If this is too uncomfortable, putting too much pressure on the area, you can avoid this, and you can use other types of hand strengthening or finger strengthening tools. But again, this I like to start with at least out here on the end, going in, kind of mashing down like that. This tool is made by the Ortho company. I do like this because it has all these little splines that you see all over it here, little spikes. And I like this because what we're going to do is put it down right here. We're going to roll our hand around on it, our fingers around on it. Now, you're going to accomplish a couple of things here. Number one, we're providing that kinesthetic awareness because we know that inflamed tissue can lose kinesthetic awareness, that cortical mapping. So I'm just going to roll this around here, different directions. Plus, it feels pretty good. If you have a sensitive area or a tight area, all this tissue's tight, kind of feels good. That hurts so good to apply that pressure and roll around on that. And so I would do that for, a couple of minutes, just several times a day, or whenever it's really hurting, you can use one of these. If you don't have one of these, you can use a tennis ball, you can use a golf ball, a baseball, anything that you have. You don't have to have one of these, but this is a really neat product, especially because of the texture on it. I like that kinesthetic awareness that it's providing. Now we're going to take this piece of round foam here. Now you don't have to use one of these. You can use a spoon or an end of a fork or maybe a tongue depressor, just really anything you had. I've had patients use pencils or pens. And what you're going to do is you're going to take this just above the palm here, place it right here, stabilize it with the other fingers, and work on kind of just bringing your fingers over the top. You're just blocking those joints at the bottom. And then we're going to move it up here in between these, in between what's known as the PIPs and the DIPs. I'm going to kind of push in. I'm pushing in with my right hand to block this, and I'm going to kind of go around like that. Now you can do that just by just grasping like this and going over and blocking. So I'd start at the bottom, I'd move up one segment and go, and then you can move down to all the fingers where you're having issues. That's a great tendon gliding exercise. Now, if this is multiple fingers, that are involved, using something like this would do well because you can encompass and kind of treat all of them at the same time. Another thing you can do with this is you can take this and work on just rolling this down and rolling it out, rolling it down and rolling it out. And you can use a pencil or a pen to do this same thing. Again, a great tendon gliding exercise. And I would complete, whether it's this movement or the previous movements that you've seen, I would complete something between 2 to 3 sets of maybe 10 to 20 repetitions. You can also take one of these gua sha tools or soft tissue mobilization tools or muscle scraping tools and go all over the palm and the area. You can use a lotion or an emollient with this, kind of go all over the area. Again, you're just providing that kinesthetic awareness, some of that cortical mapping, because we know that inflamed tissue, in a lot of cases, you can kind of get some misrepresentation of inflammation and joint proprioception and all these different things. So you can kind of do that. There is, some clinicians are going to use this for, myofascial adhesions or a cross fiber friction massage. Now, with that, again, that's just your preference and, whether your rationale for using this is to break up adhesions and all those different things. So definitely this video is not to argue whether that actually happens or doesn't happen, but if it works for you and it feels better or it helps your patient, then I go ahead and use that on that area as well. And I spend a few minutes doing that. I typically don't do that really aggressive, just a light shading or a light gliding across the tissue. Stretches work really well to try to maintain any range of motion that you have, the integrity of the range of motion. So you're just going to go back and pull your fingers like this and your wrist back in this position. You can go back in this position, hold it for 30 seconds, maybe even a minute. You can bring each finger down individually. Now you have to be careful with this. If you have an arthritic condition where you have the joints are inflamed, you want to be very careful with this, not to overstretch the ligaments, especially if you're in a period of inflammation. Aside from the Dupuytren's contracture, if you're experiencing an RA episode or a flare-up, you want to be careful, and you definitely wouldn't want to overstretch these ligaments going in this position. But I would do that. A simple stretch for this is kind of what's known as like the praying hands, or going into extension like this, and you can hold that. I'm using my right hand to stretch my affected left hand and fingers here, and that does really well. And again, you're going to hold that for 30 seconds, maybe 60 seconds, and I just repeat that throughout the day. Another option is to use splinting. So there are splints that you can buy prefabricated, or you can go to a therapist or someone that can make you a splint that you sleep in at night to kind of keep your fingers out straight to try to reduce some of that flexion that's going to occur at nighttime. And so, that's something that you can try as well. Sometimes those splints can be painful. Just the pressure can irritate the areas. So if it's too painful or it's more harmful than not, then I would not use them. But again, it is an option that you can do to try to maintain the range of motion that you have. Hope this video helps to try to give you some ideas conservatively that you can do to try to help your trigger finger. As always, make sure you talk to your doctor before you perform any of these activities. If this doesn't get any better, sometimes you need to have a steroid injection, and sometimes surgery is recommended. Thanks so much for watching, guys, and I'll see you next time.